This morning we have a terrific panel sponsored by Merck, and we're going to be talking about adult immunization. Did you know? Did you know that immunization is not just for kids? And so we have a stellar panel here for you, and I think you're going to find this conversation very interesting. There'll be an opportunity for questions later on, and we hope some answers as well. Remember now that there's a new government and a new parliament, perhaps question period will actually be answer period as well. Now, the first person I'm going to introduce is Ruth Ackerman. She's the Director of Professional Practice Development at Shoppers Drug Mart and a practicing community pharmacist. I don't think she can fill your prescription here today. I think that's not allowed, but you can certainly ask her about that. Next to her is Jim Armour, Vice President in Consumer Strategies. He's also an individual director for advocacy at the Canadian Pharmacists Association. And the next woman needs no introduction. And when you see her face on TV, you might say, oh no, now what? Because, of course, you will recognize her as the calm face on TV along with the late Donald Lowe during the SARS crisis here in the city, and Dr. Alison McGeer, microbiologist, infectious diseases consultant with Mount Sinai Hospital. Please welcome your panel this morning. Now, I've asked the panelists to tell us a little bit more about their work and their focus on this issue. But I'm going to start with the questions, and in the course of their answers, to give you a little bit more of a fulsome description of their work and their mandate. I'm going to start with Dr. McGeer. Alison, tell us what is so important about adult immunization. A lot of people don't think about immunization for kids, but of course we saw Sidney Crosby and his mumps, and then we started to think about it. Alison.
Well, partly it's evolution. The first vaccines that people focused on, you know, when you wanted to, 100 years ago, when you thought about what diseases do we want to prevent, the big diseases were childhood diseases. So some as many as a half or 3/4 of children who were admitted to hospital were admitted to hospital with an infectious disease. So people started to work on preventing diseases that were children's diseases. And over the next 60 years, we developed, particularly in Canada, this extraordinarily effective vaccination program for kids. If you're a Canadian, you don't have to think about vaccinating your kids, right? You turn up you deliver your kid at the hospital, somebody says you need to see your doctor when your child is 2 months old, you turn up at your doctor's office, your doctor says, okay, these 3 vaccines today, see you in 2 months, and the whole system just runs. And it's extraordinarily effective. It's so effective we don't even think about it as a system. And I remember what brought it home for me was, I don't know, a decade ago, when I joined the National Advisory Committee on Immunization, I'm an adult infectious disease person. So in the world of medicine, once you get past family medicine, everything is divided into big people and little people, okay? And I deal with big people. And I get to the National Advisory Committee on Immunization, and people are talking about the introduction of a new vaccine, and they spent 3 hours arguing about whether the recommendation was going to be a booster dose at 15 months or a booster dose at 18 months. And I'm sitting in my chair thinking, really? We got all this brain power in the room, and we are arguing but that's actually very important, because from a system perspective, if you want a system to work without thinking about it, there have to be rules, and they have to be set rules, and they have to work. So there's, in the background to our children's immunization system, we have this huge effort that is driven to making sure that those of us with children don't have to worry about it. On adult immunization, then we started to get vaccines for adults. And somehow we just thought it was going to work by itself. Okay, now, part of that is that adult vaccines are more difficult, okay? There's more, when you're talking about children's vaccines, you have to deal with a birth cohort every year. You talk about adult vaccines, suddenly, well, these people who start at 18 and go to 110, and they do different things. So there's vaccines that you want to think about depending on what your job is, and vaccines you got to think about depending on where you're traveling. So it is more complicated. But it's also just about, we don't have a system in place. So the further I got into thinking about treating adults with infectious diseases, you start out treating people, and then you start thinking, wait, how did I get here treating this? Wouldn't it be better if we just didn't have it? So more and more of what I do is about preventing disease, and a big piece of preventing disease is about vaccinations. And as we start to build, now we have this growing collection of vaccines for adults, which are really good and very useful. And our biggest problem with them is we don't use them effectively. So to me, one of the next big challenges in infectious diseases and public health is how we take a bunch of good vaccines that we've got and optimize their protection for the people who need them. And I will stop there. Give somebody else a chance to talk.
No, I will. I'm sorry. Jim, tell us a little bit about the Canadian Pharmacists Association's work and how it intersects with the whole work of adult immunization.
Sure. Well, pleasure to be here. And so I'm here representing the Canadian Pharmacists Association. We represent about 30,000 pharmacists from across the country, about 25, almost 10,000 community pharmacy locations. So just to give you an idea of the breadth of the profession and just how prevalent we are in most communities. The CPHA is an advocacy organization much like CARP, and we've gone through a bit of a reorganization in the last little while, and we brought in folks to the board that were not pharmacists. Before, it used to be all pharmacists, and they decided they want some folks from the outside, from the community, some very skill-based directors as well. So in my day job, I work for a government relations firm, which means I'm a spin doctor. So you should not take medical information from me. Anything I say, do not go out and do it. On advocacy, you can listen to me, but not on medicine. In terms of our focus, because advocacy was a huge focus for us, especially in the last election, there were a few things that we focused on. One was e-prescribing. Canada, and I guess the whole business of prescribing, we're just a step up from carrier pigeon. I mean, doctors still use pen and a script. The fax machine is still widely used in doctors' offices, and it's not particularly efficient, and it's not good for patient safety as well. There are easier ways to do it. So that was a focus for us. A national immunization strategy. Now, for the purposes of this election anyways, because CARP had the seniors base well covered, we tended to focus a little bit on childhood immunization, just simply because about 25% of Canadian children aren't fully immunized, which I found was an astounding number. And there was a UNICEF survey that ranked Canada about 28th of 29th comparator countries. So it's a huge, huge issue. But a lot of the things that we were looking for, which is standardized schedules, some sort of registry, all these things are things that are applicable to this issue that we're talking about this morning. And the third big issue that we were focusing on was pharmacare. And there's been lots of talk about that. And when pharmacists were talking about it, we had a completely different perspective than others in the health industry. A lot of people were talking about, covering absolutely everything, first dollar coverage, and this massive, massive program. And that didn't really ring true for a lot of our members, and we thought it probably didn't ring true for Canadians as well. So we did a little bit of polling, and we found a few interesting things. Most Canadians are fully behind the idea of pharmacare. They don't want anybody to fall through the cracks, and they recognize that there are gaps in terms of coverage and what the public covers and what private plans cover. But there was a couple of cautions. So we did some polling, and we found that while most people were supportive of the idea, about 3/4 were very concerned about losing their private plans. and that the plan that was going to, this pharmacare plan was going to be somehow inferior and provide worse service than the private plans that they had come to rely on. You know, the other, well, not particularly shocking actually, because you're well aware of the federal government and how it wastes money. About 85% of respondents did not trust the government to run the pharmacare program, right? So that was another takeaway for us. And also lastly, about 70% just felt that it was going to end up costing taxpayers more money if it was done improperly, that it was going to lead to more prescription drug use and hit the bottom line. So those are the three issues, but I know we're here to talk about immunization, but that's just to give you a broad view of what the CPHA is doing these days on advocacy.
We'll be talking to you about our pharmacare policy later. We probably have some disagreements, so we'll be happy to start bringing you along with our point of view. And on, yeah, right. So on adult immunization, what is your association's position on that? How much do you think they can be part of the solution of getting it out there?
Well, I think, you know, I think pharmacists can be a huge part of the solution, just given, you know, the numbers, given the fact that, you know, we're in almost every single community, well, pretty well every community across the country. We tend to be, you know, one of the most accessible healthcare professions. I mean, most grocery stores now, you know, along with picking up a bag of milk, you can actually go in and talk to a health professional as well, and, you know, the hours are almost equivalent. So in terms of accessibility, I think pharmacists have a lot to offer. Also, I think governments more and more are recognizing that pharmacists can play an important role in our healthcare system. And so they're increasing the, you know, the scope of the powers that a pharmacist has. So, you know, right about now, most provinces, with the exception of Quebec, pharmacists actually have the ability to inject medication. Now in Ontario, that's limited only to the flu shot, which is a real problem.
Comment on that. Ruth, what is the rollout now and the role that pharmacists and especially groups like Shoppers see as an opportunity to be part of the public health solution?
From a Shoppers Drug Mart standpoint, one of my roles is practice development. When I started practicing pharmacy a couple of years ago, it was very much count, pour, lick, and stick, very much focused on filling that prescription accurately. Very little counseling went on. And as time's has gone on, we are starting to see the government opening up the regulations and legislation so that pharmacists can do a lot more than just dispensing. So as that is happening, the underlying the curriculum has started to change as well, a lot more practice focused learning before they graduate. When I graduated, a Bachelor of Science in Pharmacy was good enough to be a pharmacist. Now it's a PharmD, which is a more intense program. So underlying that, that's what's happening. And as the scope changes, as we get more of these powers, what happens is that we need to certify pharmacists to do these expanded scope services. So with respect to injections, it kind of started in BC, I think. They were the first ones that got the power to inject. And it really took off when Ontario got the power to inject. And for an organization as Shoppers Drug Mart, we supported all of our pharmacists to get certified in an injection training. So injection training for a pharmacist is an online course, quite intense. I think you had something to do with the Ontario one, but so it's very intense, plus a lot of practical work. And last year, in the last flu season, pharmacists in our organization injected 1 million shots of flu shots. So we've gone from 0 in 2012 to 1 million. So we've really taken on that role. we've done a lot of work as well, trying to see, well, who are we injecting? Like, who likes to come to a pharmacy and get their prescription filled and their flu shots? And what we're seeing is we are actually getting to the nugget of the people who really, really need these injections, because people who have chronic diseases or are older may not be able to get to the doctor. They may not have the transportation. So pharmacies are there, and as a colleague said, that we're available. We're open long hours. I work in a 24-hour store, so we never close. And injections can be, you get your flu shot anytime. So there's lots of opportunity to expand, to assist the rest of the healthcare system to increase immunization rates. And in fact, we're starting to see that. It's not just that we're doing the injections that would have been done in a public health office or in a doctor's office. We're seeing more people getting their flu shot. And we're seeing people who really, really need their flu shot, people with chronic diseases and are older. So it's a good news story for sure. And pharmacists at first were a little reticent about, this isn't something that I signed up for, but and from my point of view, I mean, we didn't even talk about injections when I graduated, and at first, I even myself, to be honest, it was like, is that really my job? But now that we have started doing this, it changes the relationship with the patient, and it's going to, I think, enable us to I think, the public to understand that we can do a lot more than what we're doing today. So you're going to see pharmacists do an awful lot more. We have expanded scope. We don't do all of our expanded scope right now, but I think that you're going to see over the time, we're going to become a lot more comfortable doing it. The public's going to be a lot more comfortable with it as well.
Ruth, I want to ask you about that, because we did have a chance to meet with the Dean of Pharmacy a couple of years ago, and we did ask him the question. I'm going to ask you the question. Is every single pharmacist in every drugstore in every town capable of taking on the expanded practice, injections being one of them, and of course the expanded practice that we hear about of, changing the prescription or renewing regular prescriptions?
What we're finding is you always have the early adopters. Excellent. Like, I was excited about it because my whole career has been pushing for an expanded scope, because we don't just know drugs, we know disease as well, and we have such a huge role to play. We see people a lot more than the physicians see people. We have so many opportunities. So it's becoming, so the early adopters take it, and then everyone else kind of looks at them. We had this issue in Saskatchewan, just got the ability this fall to give flu shots. And it was almost like they're looking at Manitoba going, this is just not fair. How come Manitoba gets it and Saskatchewan doesn't have it? And it's becoming a standard that every pharmacist is injection certified.
Yeah, well, when the pharmacists are competing with each other to give us better service, that's always a good thing, and that's good to know. Alison, you mentioned that we needed a systemic change, a systemic approach, which without denigrating government, they need to have the political will to do it. They need to see the political need to do it. And that means the general public needs to understand why this is so important. And I think that we probably need to spend a bit of time to understand that better, that there is a real cause for concern. You've done some work with Ebola and so on in Africa. Talk to us a little bit about the need for the entire population to be better immunized generally, especially seniors.
Well, I don't know that it's actually especially seniors. I think seniors maybe spend more time thinking about whether they need vaccines. And one of the things we know about vaccination and prevention is the more you know about something, the more likely you are to do the right thing for prevention. Okay, if you listen, if you ever have a spare hour, there's a podcast you can get on iTunes from a guy called Harvey Feinberg, who used to be the chief of the Institute of Medicine in the United States, which does policy development and advocacy for advances in health. And he gives a talk called Why Prevention is a Hard Sell. Which just sort of introduces us to all of the reasons why, as human beings, we do a lousy job in prevention, okay? And there's also some really nice psychology now about how that the inability to do prevention well is affected by our risk perception. Okay, so one of the problems with us as human beings is that the moment I talk to you about risk, you get a brainstem reaction that wants to send you screaming off into the night, okay? And it doesn't matter what the risk is, okay? Earthquakes, plane crashes, vaccines, right? When I say flu vaccine to you, you think side effects, yeah, of some description, right? And it's your cortex that has to do the override and say, no, 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 this is a smart thing to do. But there's a lot more traffic, neural traffic from your brainstem to your cortex than is from your cortex to your brainstem, okay? So we are hardwired to be irrational about vaccines because of that approach to risk. And that's a really interesting thing. You know, people keep looking at me because I work in a hospital. I help to run our staff influenza campaign, and people look at me and they say, why don't healthcare workers, why doesn't every healthcare worker get vaccinated? We know, we have incontrovertible evidence that getting your flu vaccine is better than not getting your flu vaccine for everybody as an individual. Best kind of evidence you can have. And we have very good evidence that when healthcare workers get vaccinated, they protect their patients. So why don't healthcare workers get vaccinated? And the answer to that is they're people. And people don't behave rationally about risk. It's absolutely predictable, okay? We are always going to be irrational about it. And that irrational piece is why we need to focus on prevention programs and immunization programs and think about them systematically, because we know that none of us are going to do it right by ourselves, okay? It's just not going to happen because that's not how we're wired. So, and you see that happening. I mean, I think everybody read the Disneyland measles outbreak stories, right? A lot of people questioning, and you know, rightfully often questioning our vaccination programs, but when you question them to the point of supporting things that are not best preventive practice, then you start to get into trouble. And so this is it's a really difficult thing about immunization as both a risk perception and a prevention issue. Trying to build systems that allow us to do the right thing. And a piece of that is recognizing that at a policy level, we are counting on our professional groups, our advocacy groups, our government, to strengthen the cortical messages and write policy that is going to get past our inability to be rational. Okay, and so it makes policy critically important for providing immunization services.
Absolutely. I wanted you to comment just because we're talking about irrationality, and when we're dealing with government, we need to show that the entire population thinks of as one, whereas they're hearing from a lot of irrational voices as well. I know that I've heard you hold forth on the anti-vaxxers. And just to provoke you this morning, what do you think of Jenny McCarthy?
You know, Jenny McCarthy is a human being like the rest of us, but I think it is, you know, that's a really effective illustration of the fact that people are willing to believe really stupid stuff about vaccines, right? There was a great interview on CBC that I heard a while ago about a woman who she was describing her experience as an anti-vaxxer. Okay, when she had her second child, she had wanted a midwife to deliver her baby, and she'd gone to this midwife, and this midwife was anti-vaccine, and she says slowly she got into this, you know, anti-vaccine group, and then she didn't vaccinate her next two children, and it was several years later when she woke up to the fact that the group of friends that she now had, you know, related to her interaction with the midwife, who were solidly anti-vaccine, were also paranoid about a lot of other things. okay? And she was having trouble believing them on, I can't remember what it was, climate change, something, evolution maybe. And she said she woke up one morning, she thought, if I'm disagreeing with these people on these other things, why am I believing them on vaccines? Maybe I should find out. So she started looking, and eventually, after she'd spent quite some time doing it, she decided that she should be vaccinating her children. And so that issue of, just the bundling of vaccines with other concerns about, what public health people are out to do to you or what the government is out to do to you is a sort of secondary issue. But it somehow, when it gets tied into that, it makes us willing to allow people to say, it's not, Jenny McCarthy can think what she likes. That the television station that she works for allows her to say it on air. Well, that's something different, right? That's a system issue that we really ought to be fixing.
We're getting them into our crosshairs too. But let me give you some heart. We poll our members twice monthly around various issues, and in anticipation of this panel, we poll them on immunization. And the top 3 findings were very interesting, and this gives you a flavor of who you're talking to here, and of course from across the country. 75% of those people polled believe that it's a citizen's responsibility to receive vaccinations and to prevent the spread of flu. 66% of them believe that vaccination is one of the most important public health tools. And 93% believe that the healthcare system should cover all vaccines. Let me just belabor that last point. We don't spend a lot of time denigrating government because we look to them for solutions as well. And one of the things that we talk about is the need to make sure that everybody who needed medications, including vaccines, of course, is covered or is able to afford them. So you drive the price down so everybody can afford it, or you should make sure that they're covered so that everybody can get it. So one of the things that exists in Canada, of course, is public coverage of needed medications to a greater or lesser degree, often for seniors. But not entirely. In the case of vaccines, however, it's sort of more ad hoc. There was a national immunization strategy and fund, which is now completely depleted. And the question is whether this new government will refill it again. So one of our missions at CARP is to make sure that that fund is refilled so that people who see the need for vaccination go and get it and are covered. So Jim, as a spin doctor and advocate, how would you help us make sure that that fund is refilled?
Okay. Well, I mean, I think the prime motivator for most governments, the way to get them to stand up and take attention and pay attention is to talk about the bottom line, usually savings. And, when I look across the country, especially in provincial capitals, if you ask me who was the most powerful person around that cabinet table, traditionally it used to be the finance minister, whoever, he or she was. But now it's the health minister, because the health minister controls close to 50% of most provinces' budget. So every province, no matter how much money they're getting from the federal government, has to pay attention to their own bottom line. So they're looking at ways to provide health care, more efficiently. And so I think that's what led to the big push behind expanding the scope of health professionals like pharmacists and, perhaps paramedics in other jurisdictions, because pharmacists can deliver that service far more cheaply. And I know from talking to some hospital administrators, the goal for them is to actually keep people. They'd like to get their wait times down, but their number one goal is to keep people from crossing over that threshold into the emergency room. Because as soon as they do, that's a huge drain, and it's usually unnecessary. So in talking to some hospital administrators, what they're even talking about was setting up a pharmacy next door to their emergency, and they're triaging patients saying, you don't need to go down through this door into emerge, you just need to go and see the pharmacist next door. So, I think the more organizations like CPHA and like CARP can make the financial argument for why vaccines are going to lead to savings, down the road, I think that, that will bode well. And as far as, the new government, I think there is certainly a sea change, or there will be a sea change in attitude towards healthcare. Whether huge pots of money are going to follow that, I'm never entirely sure, because there are a lot of people with a lot of promises and a lot of people looking for program change. So I think there will be more money, and in the past we could rely on health professionals, on health agencies, on public health folks, people within the public service to be pushing that case. And I think we'll be able to do that again. We'll be able to count on some of our old allies.
Come from that, and I'm going to overwork Alison today, but I'm going to first ask Ruth, how much do vaccines cost anyway? They're not one of our most expensive drugs. Well, I knew who knew it.
Well, I don't know exactly. I was thinking the shingles vaccine, I think, is something like 200 and something. It's quite
Is that the most expensive one?
Yeah, I would say so. The other vaccines, if you think of Hep B, Hep A, that you would use if you were on going south or something, they're not as expensive. And some of the oral vaccines as well. Dukoral, I think, is about $75.
So under $100, generally speaking.
Generally, but not
Okay.
shingles, though.
Alison, I wanted to come back to you because the cost-benefit analysis is important when you're dealing with government. If you give people this prevention medication and pay for it, they will not cost you $1,000, $2,000 a day in the hospital, et cetera. That's a good argument to make. But Alison, I want you to comment about the human cost of not preventing certain diseases. Whether Ebola, we didn't have a vaccine before, but things like shingles, you just mentioned that, and other pneumonia, it's called the old person's friend in not a good way. Tell us about the human cost of not taking preventive measures.
Well, I think, listening to the bottom line, as you all know, if you've been talking about the healthcare system, one of our problems is that the need for healthcare is insatiable. It has no end, right? And anytime we create possibilities, they just get sucked up in more need. And that actually makes discussions about the bottom line really difficult, because I can go out there and say, if we give vaccines, we're going to prevent people from coming into the hospital, and the health minister is going to look at me and say, yeah, right, Alison, the hospitals are still full. Okay, this isn't working. So that tells you how important it is that we're really working hard on system reform within the healthcare system. That we understand that the investment in prevention and things, we want to be tied to understanding how to keep the need and the cost of the healthcare system down, because it can't just overwhelm everything, and the making things more efficient and reorienting how we care for things is a piece of it. And I think that means that although the bottom line is the most important piece, the human side of preventing illness is also really important to government. At a government level, then you need two things, okay? The first is you need stories. Okay, one of the really interesting things I'm watching is what happened to the shingles vaccine, okay? Because we're very clear in our public health programs in Canada that the reason we vaccinate people is to prevent serious illness and death, okay? So what public health people look at when a vaccine is introduced, when they're thinking about recommending it for use, is how many lives are going to be saved, how many hospitalizations are going to be averted, okay? So, and the panel at the federal government is substantially pediatricians, okay, because a lot of what we do is about pediatric vaccines. So I'm watching us coming up to the discussion about thinking about shingles vaccine, thinking, how are we going to talk about shingles vaccine? Because very, very few people die from shingles. It does happen, but it doesn't happen often. The burden in shingles is just the awful pain, right? It's the misery it makes your life, but it's not misery that is obvious. It doesn't result in huge healthcare costs, right? And how are we going to think about that? And interestingly, everybody said, oh yeah, we need this vaccine. It was immediately obvious to people. And it was obvious to people because all of us know somebody. Shingles is so common that all of us know somebody who's had shingles and understand how miserable it is. So a piece of it is about just our human understanding of what the burden of disease looks like, despite the sort of wide range in burden of disease. And the harder things, actually, to get people to take are things like pneumonia vaccines, because you can't do that same thing. You know pneumonia is miserable, but it doesn't have a human face in the same way that shingles does. The second piece, which is another piece where we struggle a bit in Canada, is what governments need if they're going to spend money is data about how that prevention translates. And that's somewhere where the Americans and the Europeans are regrettably much better than we are. And hopefully one of the places that we'll be investing money with the new government is in our ability to count burden, our ability to understand exactly how programs, whatever they are, immunization included. Part of the reason I want it is because I know what's going to happen if we do that, is that immunization programs are going to run right up the list, okay? But it's if we get better data, then we'll do better with managing the healthcare system and understanding what we need to do.
That's right. You know, Alison, I think there's another factoid I have here from our poll that explains why you have such strong support from our membership on the issues that we're talking about. 45% of our members said they had gotten shingles before they had gotten any kind of prevention. So, it wasn't available or they didn't get it, but they got it first. And as they say, a conservative is a liberal who's been mugged. So it's the kind of situation where until you know or see somebody who has had to suffer something, you don't understand the importance of it. And so let's not make sure that everybody has to get mugged before they understand the importance of doing something first. Prevention is a luxury we have in the first world. Let's take advantage of that. So it is one of those kinds of things that our polling helps us pick up a sense of our opinion, usually translated into votes. And so that's where we work. The medical information, the data that we have to have, of course, is information we have to bring forward as well. And I appreciate that. Where should we get the information about what we need? So many of our members said, well, the doctors didn't really cover it, and they really didn't ask their pharmacist, should I get this vaccination or that vaccination? There's a whole list of things. Ruth, in your practice and in your pharmacist practice, is there time for people to go through the entire routine of these are all the vaccinations you need? If you are immunocompromised, you can't take this vaccine, et cetera, et cetera. Where is the best place to have that conversation?
Actually, one of the best places is a thing called a medication review. And originally, medication reviews started off as just what we call the best possible medication history. What drugs are you on right now? But as time goes on, it's becoming more of a touch point with the pharmacist. So it's not just what drugs you're on, because people are not just their medications, and it's not just medications that keep you healthy and allow you to live well with chronic disease, but it's also the other things. So we're encouraging our pharmacists to sit down with patients and talk to them about more than just their meds. So talk about the meds, look at what they're taking, make sure they're taking it properly, make sure that they understand why they're taking it. You'd be surprised the number of people who just pop a pill every single day, but they have no idea why they're taking it. And oftentimes they're taking it more complicated than it needs to be. So pharmacists can really help with smoothing that out. And we need to talk to them, because this is an annual thing, we need to talk to them about other things. What immunizations, talked about their health and wellness, their exercise. Are they making sure that they're continuing to learn new things and using that brain that is aging as well? So we're encouraging our pharmacists to do that. And we gave a health handbook to our pharmacists to facilitate that discussion. The other touch point around immunizations is also on travel health. So if you're traveling to another country, a lot of people just think, well, I'm going to Cuba for a vacation, I'm going to have a great time. They don't even think, oh, wait a minute, it's another country, it has another set of conditions. You need to have you should have a travel health consult before you go. Some destinations are somewhat easier. You don't need to see an expert, but pharmacists can actually advise on some of this as well. And one of the things you got to think about is that if you never had measles, I mean, it's probably not for myself, I've had measles, but if you're in the age group that perhaps you might, you haven't had your measles vaccine, or if you come from another country that it wasn't standard of care in the other country, you have to consider that. So that's what a travel consult can do for you if you're traveling.
Okay, so final question to all the panelists, and then I'll leave an opportunity for everybody to ask a question from the audience. The question is this. On one hand, we're pushing for the government to cover all vaccines. On the other hand, flu vaccine is already covered entirely for the entire population, and we still have, Alison, you'll help me with the proportion of the population that gets its flu shot. Our members are out there getting their flu shots, and when we asked them, they said, yes, they've gotten one, 74% of them had gotten them. But is that true with the general population? So the question to all of you is, if it were covered, all these vaccines, and we need to know what they are. And by the way, as you might know, Immunize Canada has a handy-dandy little booklet you can use to keep track of all your vaccinations. I don't know if any of you still have left the little yellow books that we used to be handed out, but you can keep track at least so that when you have your consultation, you can at least deliver that piece of information. But the question has to be asked, if we covered everything, like we do with the flu vaccine, how do we get people to take it? I'm starting with you, Ruth.
I think the number one is awareness, and that's where, of course, a drugstore chain can get big advertising. That's the thing that we have started to do at Shoppers, is advertise to the public the availability of these services in store. And there's lots of, your pharmacist just triggering your pharmacist to do it. We are, as I said earlier, we are moving the needle a little bit, but there are so many people who, well, I'm healthy, I don't need a flu shot. Last time I got a flu shot, I got the flu. I get that all the time. I'm not getting a flu shot because the last time because it's got a virus in there. It's dead. So we get a lot. So there's, again, this risk. It's not for me. I don't need to worry about it. And I think a lot of people have no idea that what they can do to others. And I don't think everybody understands the magnitude of what the flu is as well. I don't think they realize how sick you really are when you have the flu.
So how do we get them to take it? We pay for it. How do we get them to take it?
I think you need to educate.
Okay, well, we're starting with that. Jim?
Start young too is what I'm thinking as well. I mean, if you want to get a rise out of your grandchildren, the only thing that you need to do is toss a tin can or a plastic water bottle in the garbage, and they will freak out and almost call the police, I think, because you haven't put it in the recycle bin where it belongs. So, I think that if you start the education sooner and it becomes part of everybody's health regime, then it'll be as socially unacceptable as smoking to be wandering around without a vaccine. But that does take effort, it does take coordination, and we're not particularly good as a country in the coordination part.
Alison, we're going to use your image and your conversation in a 30-second spot that will tell Canadians, please get your shots.
Over to you.
And we'll use that to rally all of our members to say to government, make sure everybody can afford to get their shots. How would you do it? 30 seconds.
Well, this isn't going to work because I'm going to say something deliberately provocative. You know how to get people to get their flu shot? Pay them for it. Okay? We already have incentives for physicians to keep their patients up to date with their vaccines. Okay? One of the great things about moving immunizations into pharmacies is because if we incentivize pharmacies, if we make it part of good practice, if we pay pharmacists for doing it, then pharmacists will do it better. There are a number of jurisdictions in the world that are actually experimenting now with tax credits for people who are up to date with their vaccines. So what that's doing is get past what's the best way to get past my irrationality? Give me a reason to do it. Okay, so this is not to say knowledge is critically important. Okay, the more you know about vaccines, the more you're likely to do it. You have to do it. Okay, paying for vaccines, government policy, part of that's about trust, right? If the government's recommending a vaccine, I'm going to look at it as much safer. I'm not going to have to do nearly so much work to figure out if it's a good thing, because if my chief public health officer is saying it's a good thing, I'm going to believe that, right? So there's a whole long series of pieces, and they're all important. But one of the things I think we need to be talking about is how to incentivize us, the population, as well as the people who deliver it, to get our vaccines.
What an interesting idea. The theme of our advocacy this year is disruption. And you're so much in the middle of that. I have to tell you, in a former lifetime, there was this whole business with the long gun registry. Remember that? And it ballooned into 2 billion, 3 billion, 5 billion gone, right? Remember that? And at the time, I said out loud, let's pay people the $10 to go and register. Don't make them drag themselves off and pay for the process of obeying a law. Pay them to register. They're all registered, every last handgun they have. They didn't do that, so we don't have it anymore. Yeah.
Why don't you allow corporations such as Shoppers Drug Mart to give optimum points for healthy behaviors?
Well, no,
unfortunately, it's not allowed in Ontario.
Where is David? Write that down already, because of course we will be announcing something soon. But that's a great idea. Any other great ideas? No. Okay. Points. I like those points. I have a lot of points. I get a lot of good stuff with those points, I can tell you right now. So we have a few minutes to keep on schedule for questions from the audience. Right away. Here we go.
We're moving towards a digital, knowledge-based economy. How do we move? There we go. Thank you so much.
Introduce yourself.
Absolutely. My name's Hugh. I'm from Sudbury. I also work in my other life at the Center for Advanced Technology. My question is, how do we track people better? We worry about identifications going public, but we still want to keep track of who's got what. How do we do this?
I think that's a question for you, not me. Because that's fundamentally an information technology question. Very clearly, our difficulty with it at the moment is privacy issues and understanding how we set up systems where people can store medical information, but it is adequately protected. And I'm just not competent to answer that question.
Randy. Here's trouble. This is trouble coming.
Trouble. Well, I'm going to give a great compliment to the Shoppers people, but I want to change the dialogue slightly, because we tend to talk the immunizations for seniors, immunizations for kids. The discussion to get to the community, the brainstem to cortex, is to talk about families and intergenerational. So I'm mid-60s. My daughter and son are mid-30s. They got there's 3 generations, and there's nothing better than to sit down and talk to them about a health plan. And immunizations is not a standalone thing. It's a piece of that plan. So I have an equal responsibility to my kids, to my grandkids, their kids, to have that dialogue. So I'm back to the Shoppers thing. I walked in, I got the best 28-page brochure with a half-hour consult. I'm telling you, this is the best thing I've seen in Ontario for healthcare, and it's called My Health Plan when I turn 40 or 50. Immunizations are a part of it, travel, the whole thing. So I just want to, when you think of these creative ideas, don't be thinking of set populations, but get right to the community. Evidence-based, have that discussion internally, but when you come to us, we'll understand it. You don't have to pay me to go get the immunizations if I understand how they fit into the context of my whole family. Great. It's really not a question, but a comment. So.
No, that's great. Gary. Another one of our troublemakers.
Yeah, my name is Gary Butler. I'm with the Scarborough CARP chapter. This question's been asked before, but it really now may be an opportune time to move it forward and come up with a solution. I recently had my annual meeting with my doctor, and we discussed a number of things, but I said, well, he's been using me as a punching bag with all these vaccinations at my age, but I said, well, fine, I'm going to go next door to Shoppers. We're at Warden Huntingwood, a great Shoppers Drug Mart. I'll go there and get my flu shot. He said, no. He said, I want you to stay here and get it because it gets on your record. So here's the question, and I know it's been bantered around, but it's a key one now. As we get into these auxiliary or complementary services, such as providing vaccinations, and there are a range of them, and they can be done at drugstores and whatever, that information, I would suggest, has to get back to the doctor's office for a number of reasons. One, the doctor knows where you stand with your medical coverage, and the pharmacist is actually risk-free at that point too. There's a number of concerns. So I'd be interested in getting the opinions here about where we are in that process and how it may work.
I can't speak for eHealth in Ontario because I don't sort of know where they are, but I can. It just shows you what happens when government does something. There's an Ontario drug benefit database with all of our health card numbers, and it has all our drugs, all the drugs in it. Now it's not attached to anything else. And then there's this. Then when flu shots came in, it needed to be expanded to the entire population. So they built a brand new database, and the health card number went into that database with that information, separate from the other information. So it's like no planning ahead of time to say, hey, we need to integrate all this. We need to figure out a way so that when the pharmacist enters your health card number into the computer, sends it off to the ministry, that it's automatically sent off to the doctor's EMR. The only other way for me to communicate with that physician is to print out a piece of paper, say, Ruth Ackerman got her flu shot, and then fax it to the doctor. And what doctor wants a pile of faxes this deep? Because there's lots of other faxes they're getting every day. So it's such a clunky technology, and I do respect the fact around privacy and that's a big challenge for us. But I think other provinces outside of Ontario are doing eHealth, and we need to connect the two. We really, especially as pharmacists start moving into these expanded scope. When I extend a prescription for you, or if I adapt a prescription dose or dosage form, I need to contact that physician, and the only way to do that is by fax right now, and it just doesn't make sense in today's day and age. Anyone else use fax machines? No, can't even email them.
Nobody. Okay, did we have one more question? Oh, here we go. Of course. What meeting could we have if Ron isn't asking a question?
A number of the comments that the panel has made provoke this question. Number one, the comment that 50% of every dollar being spent by the provinces is spent on healthcare. And I think it's safe to say that almost every province is working on a system transformation of some sort, I know Ontario is, to try to do things more efficiently. And the buzzword, if you work in healthcare anyway these days, anywhere, is patient-centered care, which makes my little bit of hair stand up because I don't think we're doing patient-centered care. When you have to sit in an emergency room until sometimes you die, which has happened in the other parts of the country, it's way too long. And 80% probably of the patients in that emergency department could be treated differently in a clinic. The question I have is, within the scope of practice that you presently have, could you have a clinic in the corner of your 24/7 pharmacy with a nurse practitioner and a pharmacist who could deal with those 75 to 80% of patients who don't need to be in the emergency department at all?
That's a good point. Urgent care centers. Some hospitals have them now. Is it possible inside a pharmacy?
Well, if you happen to live in Alberta, lots of pharmacists do have the authority to prescribe medications, and they're prescribing for acute conditions. The other thing that's happening is that prescribing for pharmacists is starting off with minor ailments, and minor ailments it's minor in that they're not life-threatening, but they certainly are major to a patient, and they're clogging up emergency rooms and that sort of thing. The scope changes, of course, from province to province, but in New Brunswick, pharmacists are prescribing for uncomplicated urinary tract infections. And if you can imagine how vital a service that is, and keeping people, because if you have a UTI, you are urgent care, because it's like the shingles situation. You can't go without it. So there are lots of ways to do things to take advantage of what pharmacists are learning in school and what we can do, because we're open for that access. The other thing is a more complex thing. Perhaps we do something like telemedicine, where there's a video link up or something like that. Let's use the technology that's already available to us. So I think it's a really good point. Like, let's have more access to care and use the healthcare professional that can do it.
Last question to Terry.
Actually, I got three. So let's do the very well. The first one is a suggestion, really. And why not use peer pressure take a look at this beautiful lapel pin that says CARP. So why not have a lapel pin that shoppers or somebody, one of the organizations gives out, says, I've been vaccinated. So that way, you can't believe how many people come and say, okay, what does that mean? So that opens up the door, and we don't have to talk about privacy issues because it's a voluntary aspect. So that's one. The real question here is to you, Ruth. You talked about your education and your studies. I wanted to know, did you have a special course to decipher prescriptions from doctors with their notorious scrolls?
That's why e-prescribing is necessary.
Actually, yeah, no, we didn't.
The second question was to Dr. Allison. Can you say a few words about the superbug or how drugs become resistant? The viruses become resistant to drugs? Because I heard on the radio recently, and that was of great interest.
You probably all of us have heard about antimicrobial resistance recently, and it has been, it's another one of those prevention issues that has always been present. It's always been a concern, but it's a little bit like adult immunization in that it's what people talk about now as a wicked problem, okay? And wickedness is not necessarily about evil, it's about complexity, okay? The very complex problems that don't have single solutions or easy solutions, but need a lot of thought and many small solutions. And we are, there's no question that we are entering an era of resistance treatment for a lot of things. People might have seen, there was, I think, a Globe Mail article last week about lice are becoming resistant to the topical treatment that we've been using routinely. So it's infestations, and it's smaller parasites, and it's bacteria and viruses, and that's another piece of that we need investment in on multiple fronts. That since we're talking about immunization, okay, immunization is actually a critical piece of preventing antimicrobial resistance. Because one of the first things they teach you in medical school is that primary prevention is more important than anything else. So if you don't want resistance, what's the best way not to get resistance? Not to have the disease, right? So one of, in fact, the important pieces of our fight against antimicrobial resistance is getting people to get their vaccines. When we don't have the disease, we can stop worrying about it.
Well, on that note, thank you, Terry, for the question that provoked the answer referring to lice infestations. Right, I will recover shortly. To summarize today, we heard why it's important. First of all, that there is such a thing as adult immunization, why it's important, the easy way to prevent it that we don't take right now, the opportunity to get more information about it from your pharmacists, from your doctors, from general public education, the opportunity for us to be part of the solution to convince government to do one of two things, the thing that we only thought about until this morning, which was to get government to fund it as they have in the past and refill that national immunization strategy, which, by the way, was created by Carolyn Bennett when she was parliamentary secretary for health. And so now that that government's back in power, perhaps that should be an easy balloon to blow back up. But the more disruptive idea of giving people an incentive to actually do what's good for them is not a bad idea at all. How many people have had to deal with this with their kids or grandkids? So it's not a bad idea at all. Money is good. Optimum points are very good as well. You buy things with optimum points. I'll learn to say it. You buy things with optimum points that you wouldn't pay for in cash. You buy your luxuries with them quite often. So it's interesting. And it's an opportunity for us really to shift that landscape. CARP members already are quite aware of the need. They're looking after themselves, but they're ready to, of course, as usual, advocate for the needs of others. So I want to thank our panelists, Dr. Alison McGeer, Jim Armour, and Ruth Ackerman. And I also want to take this moment to specifically thank our hosts, Susan McLean and Catherine Paquette, if they would stand up from Merck. And they have been working on the immunization file for quite some time. Charter members of Immunize Canada, and they have been working behind the scenes for a very long time to make sure that we do the one thing that can help our own health, which is to prevent disease, prevent bad things. Also with us are Jeff Malkowski and Mattia Tan from Shoppers Drug Mart. But we had lots of accolades of Shoppers as well. So thank you for everybody, and let's have another round of applause for our fabulous panel.